My name is Lynette Mabote and I come from South Africa. I work for the AIDS and Rights Alliance for Southern Africa. Many people will ask you, why did you decide to be an advocate? Why did you decide to work in HIV/AIDS? You tell them the reason that you've seen people die, you've seen family members die, you've seen your mother, your father, your cousins, your grandmothers die because of HIV/AIDS. About 15 years ago, there was no hope. We were all scared and we saw people dying. We had 3 or 4 funerals a day. We were going through a very hard time. We were so saved, or so happy actually, to hear that there was a mechanism that could be brought together by multinational partners to fight the HIV pandemic, the Global Fund. The Global Fund has helped us in South Africa, as well as in other SADC countries, to basically save a lot of lives and to put people on treatment. The Global Fund has helped not only to put people who have HIV on treatment, but those who have TB. A very important mechanism that has been working for the past 10 years, but not sufficiently recognized. The Global Fund finds itself at throes right now where governments are no longer giving money towards their health budgets. We have been asking our governments to stay truthful to the Budget Declaration and give 15% of the national domestic product to health. What we're seeing is governments still not taking this issue very seriously, which for us advocates says we need to make sure that we do all the work that we can do to make sure that the Global Fund survives. Why is the Global Fund important? The Global Fund is important because the Global Fund is there for us. It's there for our communities. It has seen to save lives. Millions of children are born today HIV-free because of the Global Fund. And if we don't sustain the Global Fund through giving money to the Global Fund through our countries, we will find ourselves in the same situation we were in 2001 and before then. HIV can be cured, and the Global Fund is an important mechanism. There are parallel mechanisms that our countries are currently involved in, where there are bilateral deals signed with other organizations that do provide treatment, care and support. But through Global Fund interventions, human rights programming has been put at the center of all the HIV and TB responses. The Global Fund is here for us and we want the Global Fund to survive. A message to our leaders is, please keep the Global Fund afloat. Please keep the Global Fund alive. Respect our rights, respect our lives, and keep us on treatment.